the white paper actually consists a lot of experts. Yes.
Okay.
I went through the United Nations universities as well, and what basically people or experts at that point in time looked at was looking at the human resource, whether there needs to be any new governance in place and how to make sure that the sustainable health care can be provided at this point in time and as cost effective as possible. That is again, it's a very tricky question. It goes back into funding, it goes back into financing. So one of the strategies that has been proposed is actually to come up with some sort of insurance, what we call as the national health insurance or social health insurance. It has been practiced in many other countries before, things like Taiwan, South Korea, even Thailand has come up with some sort of health financing of some sort. And the recent is also Indonesia. They have their own health insurance, and basically these are for the low income, also a bit of the middle income as well. And when that happens, most of these reimbursements for costs comes back from the government, goes through the government, right? So what happens to the patient or basically the population, they can actually attend a choice whether you can go to the public sector or you can go to the private sector, where at this point in time we can't unless you have money, right? So if you want to go to the private doctors, you need to make sure that you have money to pay, or you are covered by your insurance, or basically your employer pays for you, employment-based coverage. So if you have this sort of social insurance, as a patient from the population, you are able to go either the public or the private, but your payment will not come from yourself, because this puts you at risk. It will be borne by the government through some sort of reimbursement packages.